Singapore will build more elder care centres in the coming years as it faces an ageing population. Health Minister Ong Ye Kung warns the next COVID-19 wave will likely hit in July or August as immunity wanes. And Beijing conducts mass testing for millions after COVID-19 outbreak linked to a bar. Happy Monday, you're watching The Big Story with me, Haryanto Diman. Subscribe to the Straits Times channel so you will not miss a single episode. In years to come, elder care centres will play a bigger role in caring for Singapore's ageing population. Speaking at the Agency for Integrated Care's Workplace Seminar, Health Minister Ong Ye Kung says the number of elder care centres will double to 220 by 2025. From 119 currently. These centres are go-to points for seniors and have services like active ageing programs, befriending and referral to care services. And in time, Mr. Ong says their scope would expand as well to help seniors monitor their vitals and do simple health screenings. And eventually, each elder care centre should be responsible for the 1,000 to 4,000 seniors under their charge and work with community networks to address seniors' health social needs. The Health Ministry also plans to double the number of nursing home beds in the next 10 years to more than 31,000. And the Ministry will work with nursing homes to build up their staff's skills in managing end-of-life care. Let's hear more about this with journalist Clara Chong. Clara, nursing homes, elder care centres, how would they work together against the backdrop of Singapore's ageing population? What is the Minister Ong envisioning?
With an ageing population, many more elderly would most likely fall sick and need to be looked after, whether it's in elder care centres or nursing homes, and these centres would take away pressure from the acute hospitals and nursing homes. So these centres, they serve as go-to points for seniors, and they provide services like active ageing programs, befriending, and information and referral to other care services. So what Mr. Ong envisions is that for each centre to be responsible for about 1,000 to 4,000 seniors whom they work with, and they will work with these community networks such as grassroots organisations and GPs to address seniors' health and social needs. So right now, what's happening is that seniors visit their GPs or polyclinics once every few months for their chronic conditions, and in between these visits, they can go to the elder care centres to take part in health-related activities or enroll in active ageing programs. But what Mr. Ong hopes to see is that in the future, these centres will help seniors also monitor their vitals, do simple health screenings, and link up with other services and healthcare providers.
Clara, such an endeavour requires a strong manpower pool. So how do health authorities plan to retain current staff and attract new talent?
Firstly, the top priority would be to ensure salary competitiveness of staff. So about 290 million have been committed to raise the salaries of community care workers from 2020 to 2023. And secondly would be skills development. So AIC's learning institutes have scaled up offerings with more than 18,000 training places available annually. And today, what was also announced was the new initiative for digital transformation via the Community Care Digital Transformation Plan. And it's a new funding of 18 million that will be made available for community care organisations to apply for to support and defray the cost of digitization, and this funding covers up to 85% of the implementation costs. And community care organisations can also tap on the consultancy services available, as well as the skills training and courses, as well as different programs that would be made available. And finally, Mr. Ong also noted in today's speech that there will also be a need for foreign manpower to boost up the local workforce.
Thank you, Clara. Journalist Clara Chong. Mr. Ong also says that since February, more than 4,700 nursing home residents infected with COVID-19 were cared for on-site under the Care at NH program, and it would have overwhelmed Singapore's healthcare system if they'd all been transferred to hospitals. Over 80% of nursing homes are now under the program, with MOH hoping to get remaining homes on board, so they'll be ready to care for their vulnerable elderly residents by the time the next wave hits. And speaking of the next wave, Mr. Ong reiterates that it will likely arrive in July or August because of Singapore's current high immunity level from both vaccinations and natural infections from the recent Omicron BA2 wave will start to wane. When it does, the most dominant strain, likely BA4 or 5, will multiply and drive infection numbers. Eligible Merdeka and Pioneer generation seniors will receive MediSave top-ups of between $200 and $900 next month. The top-up amount for the Merdeka generation is $200, and these are the varying amounts for the Pioneer generation, which ranges from $250 to $900 annually for life. $250 for eligible seniors born between 1945 and 1949, $500 for those born in the years 1940 to 1944, $700 for between 1935 and 1939, and $900 for those born in 1934 or earlier. Seletar Airport has reopened to commercial flights for the first time in more than 2 years. And the first one to land was Malaysian budget carrier Firefly from Subang. Firefly will operate 4 flights daily between Singapore and Subang, 2 flights in each direction, and will look to increase the number of flights plying the route by the end of the year if demand picks up. Starting today, only passport applicants with appointments or passports to be collected will be allowed into the Immigration and Checkpoints Authority building in Lavender. Aimed at managing long queues and on-site requests, the new measures apply only to passports and don't affect other services. ICA currently issues more than 5,000 passports a day, almost 3 times the number before the pandemic. Netflix confirms what millions of viewers have long suspected. The Squid Game will return for a second season, with writer-director Hwang Dong-hyuk announcing the news in a letter to fans. While we don't know when the new season will be released, Hwang does say that characters Gi-hun and the frontman will return. Starting today, millions of Beijing residents are undergoing a new round of mass testing for COVID-19 after dozens of new cases were linked to a bar in the Chaoyang district. Describing the outbreak as ferocious, health officials say close contacts and even secondary contacts will be placed in quarantine. Since the cases emerged late last week, the district has suspended the operation of all entertainment venues, internet cafes, underground gyms, and sports facilities. China correspondent Elizabeth Law joins us from Shanghai. Liz, how serious is this outbreak in Beijing? Will the city be forced to announce new restrictions, you think?
Well, the thing about the Beijing outbreak is that yesterday, Beijing CDC officials during the press conference had actually said that this outbreak now is in fact worse than the Sinfadi outbreak. If we all remember, Sinfadi happened in June 2020 at a wholesale market. It was the largest wholesale market in the whole of Beijing, and that particular outbreak actually spread to most of the districts, and it brought the city into like a semi-lockdown of sorts. But that was about 2 years ago, and now the fact that they're saying that this current outbreak is worse. Today, we've seen numbers that at least 185 cases have been linked to this current cluster, and we believe that it will continue to grow. So we've already seen that there was restrictions. Pubs have been asked to close. Children who were supposed to go back to school today have now had that postponed yet again. And it's been more than a month that they've not been allowed to go to school now. So I think everyone is very frustrated, and people are worried that if the numbers keep going up, the Beijing government may be forced to take more drastic measures. And even though it seems almost unlikely, but nobody is quite certain anymore, because even up to days before Shanghai went into a 2-month lockdown, the government had still said that they were not going to lock down the city and that it would be impossible to do so. So here we are.
Liz, over the weekend, we read your story about the cost of China's zero COVID policy. Sounds like mass testing, quarantines, and even lockdowns have become a way of life.
That is true, because a senior government official in the end of May had actually said that she ordered that testing booths now be built within 15 minutes walk of all residential areas in all of China's major cities. So that means that it's clear that zero COVID is not going away anytime soon, even though these are actually part of China's COVID prevention playbook from dating back to the very early days of 2020, the sort of test, trace, and isolate measures. They still are very much dependent on it. And the fact that they are now building semi-permanent booths, testing stations all over the city. You can't walk and get to a street corner without seeing a testing booth. It really means that they are committed to this. And in a way, this has also helped to drive a part of the economy. Now, each of these booths costs between about 30,000 to 40-something thousand yuan. So for the Singapore audience, that's about 6,000 to 8,000 Singapore dollars. And it is actually fairly good money because the construction cost is very little. So you're seeing people in industries like people who make portaloos, people who make air conditioning units, people who make security stands now pivoting towards making these sort of testing booths. And even though they are sort of being used for medical purpose, they are not actually governed or subjected to any sort of health regulation. So it is actually very easy, very quick money, and everybody is capitalizing on it.
Liz, separately, you've also written about your experience testing positive for COVID-19 in China, where you spent 11 days in a hospital. Tell us about that.
Well, so I think as most people in Singapore know, and it is the same in the rest of the world as well, that if you test positive for COVID and you are not supremely unwell, you essentially isolate at home for about a week, and then after that, it is back to daily life. Or in some places, even you could go back to work earlier as long as you wear a face covering or mask. Now in China, of course, because of their super strict zero COVID measure, once my swab at the airport had come back positive, because I entered China from Singapore, I was taken to a first hospital, a triage hospital, for confirmation test. They swabbed everything. They took a lot of blood. And then I was sent to a treatment hospital where they took even more blood. They took 14 tubes of blood at the treatment hospital, did more swabs, and also sent me for a CT scan. Essentially at the hospital, because all I had was a scratchy throat, there was nothing much that they could do about it except to just let me wait until I tested negative. And so I would get swabbed every morning between 5 and 5:30. They were essentially looking for a CT value of 35. Now, CT values refers to the number of times the swab sample needs to be amplified before the virus can be seen. So it took me about 11 days to eventually test negative. But after that, I also had to spend 7 days in isolation in a government-designated hotel. Still could not be released out into the public. So I've only just regained my freedom yesterday, and I can move around Shanghai. But my health code for Beijing is still red at the moment, and also my passport number has been put on a blacklist, which means that I'm not allowed to book any travel tickets.
Elizabeth, thank you for the sharing, and do take care of yourself. China correspondent Elizabeth Law. 21 nasal and mouth swabs, 17 vials of blood and 2 CT scans For more on what it's like to be COVID-19 positive in China, you can read Elizabeth's full account online at str.sg/Asia. Those are our top stories today. Visit straitstimes.com for more news and our YouTube channel for more videos. Subscribe by hitting the red button below. I'm Haryanto Diman. Join us tomorrow for more stories on The Big Story.